Hi everyone, it's Dr. Deena. So we all know that diabetes of any form, whether it's type 1 diabetes, type 2 diabetes, LADA, gestational diabetes, all may increase one's risk of having severe COVID-19 infection. Severe COVID-19 infection can lead to hospitalizations, can lead to the need for a ventilator for supporting one's breathing, and can also lead to death. And so the COVID-19 vaccination can actually decrease all of these risks of death as well as severe COVID-19 infection in the general public as well as those living with diabetes. So it's extremely important for anyone who has diabetes to consider getting vaccinated if they haven't, and talk to the doctor about the questions you have in relation to the vaccine. Some of your fears may be justified and some actually may not be. So it's important to talk about your concerns and why you're hesitant to get vaccinated. Hey everyone, it's Dr. Deena. When it comes to the side effects related to the COVID-19 vaccination, it's important to remember that the side effects are extremely mild as well as common. We know that more than 60% of the population who've gotten the vaccine have one minor side effect. Those side effects are typically pain at the injection site associated with some redness, some tenderness, maybe some swelling, as well as fevers, muscle pains, feeling very tired, maybe some dizziness and nausea are common as well, but they do last only for a few days, and if you take some Tylenol, it may even shorten the course of symptoms. It's important to talk to your doctor if you have any questions about some rarer side effects like anaphylaxis, which is a severe allergic response to the COVID vaccine, especially if you have a history of vaccinations. But most of us will do just fine with just some mild symptoms and get better very quickly within a few days. Hey everyone, it's Dr. Deena. So when it comes to preparing for the side effects of the COVID-19 vaccine, it's important to have Tylenol and ibuprofen on hand at home, just in case you have some of those mild side effects that we talked about. But it's also important if you're a patient with diabetes to make sure you have all your testing supplies at home, as well as medications for hyperglycemia, as well as treatment for hypoglycemia on hand on the day of your vaccine, as well as for a few days afterwards. The reason why is because we've seen a lot of patients with diabetes having maybe either hyperglycemia more commonly than hypoglycemia, which can be rare, related to the COVID-19 vaccine. So you should be prepared for both circumstances. You want to be monitoring your sugars during the day of your vaccine as well as on the days that you're having side effects. And you want to make sure that you continue to take your medication on the day of the vaccine as well as the following days. Hey everyone, it's Dr. Deena. So when it comes to autoimmune conditions and the COVID-19 vaccine, it's important to know that this is not a contraindication to receiving the COVID-19 vaccine, but you should definitely talk to your doctor because many people take different medications for autoimmune conditions, some of which can suppress the immune system and may not allow for a robust response to the actual COVID-19 vaccine itself. So talk to your doctor if you have an autoimmune condition to make sure that the medications that you take aren't necessarily going to decrease your antibody response to the COVID-19 vaccine. I can tell you as an endocrinologist taking care of patients with autoimmune conditions like type 1 diabetes as well as LADA or latent autoimmune diabetes of adulthood that they do just fine, and it's important to make sure that all your questions are answered before you decide to get that vaccination. Hey everyone, it's Dr. Deena. So when you've been fully vaccinated with the COVID-19 vaccine, it's still important to take proper social distancing measures in certain circumstances, meaning wearing a mask or staying 6 feet away from others. And that would include any time a vaccinated individual is spending time with someone who's unvaccinated and is high risk for COVID-19 infection. So someone who's pregnant or has diabetes or is elderly, you want to make sure that you're being careful. In addition, anytime you're traveling on public transportation like a bus or a train or even an airplane, it's important to make sure that you're wearing a mask. They won't even allow you on to the premise without wearing a mask. In addition to that, anytime you may think you're symptomatic from COVID-19, you have a cough or you're having fevers or you're runny nose, it's important, especially at that time, to make sure that you're not transmitting any droplets, whether it's from COVID-19 or another infection, to other people. If you have any questions, you can refer to the CDC or you can feel free Hey everyone, it's Dr. Deena. So these questions are related to people who are unvaccinated. And for the most part, unvaccinated individuals must be wearing a mask and using all social distancing measures when they're outdoors. There are certain local and state rules specific to outside and whether or not unvaccinated individuals should be wearing a mask. So it's important to look into your local rules and regulations. But in general, if you're outdoors, you should be wearing a mask and maintain all social distancing measures if you are unvaccinated. Hey everyone, it's Dr. Deena. So people with diabetes are not at higher risk for side effects of the COVID-19 vaccine, but the one thing I can tell you is from the patients I've seen who have received the COVID-19 vaccine, they've told me that they've noticed some fluctuations in their blood sugar. They've noticed that their sugars have gone either extremely high or in some cases extremely low. So as a patient living with diabetes, it's important to make sure that you're monitoring your blood glucose values by checking throughout the day. And if you are having some side effects related to the COVID-19 vaccine, I would recommend to continue to monitor your sugar more closely until those side effects disappear, because these things may potentially lead to some higher blood sugars or lower blood sugars that might require some intervention with medications like insulin, talking to your doctor, or even being prepared for hypoglycemic reactions. Hey everyone, it's Dr. Deena. So people, when they develop side effects from the COVID-19 vaccine, like fevers or muscle aches, they often tend to take NSAIDs or Tylenol or ibuprofen. And it's important though to talk to your doctor whether or not those are good and safe options for you, because there are people living with diabetes who also have kidney problems, in which case sometimes we try to limit NSAID use. So it's important to talk to your doctor about what options you may have before you get the COVID-19 vaccine. Hi everyone, it's Dr. Deena. So diabetes is considered as a high-risk condition associated with COVID-19 infections being severe for many different reasons. One is because we know that persistently high levels of blood glucose can lead to an impairment of immune cells, specifically T cells and B cells. We need T cells and B cells to fight off infections, and so if our T cell and B cell function is down, it becomes harder to fight off infections like COVID-19. In addition, we know that people with diabetes tend to have other medical issues as well. So the more medical issues you have, the even higher risk you are of having severe COVID-19 infection. People with diabetes can have heart disease, they can have kidney disease, they can also be obese, all of which have underlying implications for having severe COVID-19 infection on their own. Hey everyone, it's Dr. Deena. So at this juncture, we have no data to suggest that any of the vaccines work any differently in patients with diabetes, that the efficacy is exactly the same whether or not you have diabetes versus not have diabetes. In fact, many of these clinical trials actually included patients with diabetes, and really we didn't see any significant difference between those populations. So as soon as you're offered a vaccine, you should really go with whatever option is offered to you unless there is an underlying contraindication. Hey everyone, it's Dr. Deena. So when it comes to the COVID-19 vaccine and pregnancy, we have more and more data to suggest that it is safe in pregnancy. And when I think about my patients with diabetes who are also pregnant, I think it's extremely important to consider the vaccine, because we know that diabetes and pregnancy are risk factors for severe COVID-19 infection and even death. So the benefits of getting vaccinated to protect yourself may actually outweigh the risks and fears of the unknown related to this vaccination. It's also important to think about your baby. You're going to develop antibodies in your breast milk if you choose to breastfeed, and that's going to be present as soon as this baby arrives. And that allows us to have some feeling of happiness to know that these baby can be protected potentially from COVID-19 infection. We don't know for how long, but at least it's a benefit that we should consider. Hey everyone, it's Dr. Deena. So when it comes to finding the COVID-19 vaccine that's available in your area, it's important to look at the CDC website to see what's available around you. There are some tools called vaccine finders that are published by different hospitals that the CDC will give you access to in order to find what's available around you. In addition, you can visit your Department of Health website for your specific state. For example, the New York State Department of Health might list out all of the available areas for the COVID-19 vaccine. And now local pharmacies are also able to provide you with the COVID-19 vaccine. So any local pharmacy like a CVS or a Rite Aid will be able to provide you with that information as well. Hey everyone, it's Dr. Deena. So when it comes to steroids, these are life-saving treatments for patients with severe COVID-19 infection, but they do have the unfortunate side effect of causing a rise in blood glucose values. For patients with diabetes who receive steroids in the hospital, I've seen their numbers be as high as 500 and 600 and even higher than that. And these were people that were having normal values when they were at home. So steroids will drastically change their blood glucose values. This can lead to problems down the line like dehydration, which might lead to kidney problems. So it's really important to keep your blood sugars controlled as best as possible in the hospital. Communicate with your team that you have diabetes and tell them about the medications that you're taking. And don't be afraid to start insulin for a short term only while you're getting high doses of steroids to make sure your blood sugars are under control. Hey everyone, it's Dr. Deena. So when it comes to getting the COVID-19 vaccination in your arm and continuing to inject insulin in your arm or continuing to use the insulin pump in your arm, there's really no contraindication or any interaction between these things and the COVID-19 vaccine. The vaccine will be just as effective and your blood glucose management should not change. So continue doing what you feel comfortable, and if you notice any significant changes, please speak with your doctor. Hey everyone, it's Dr. Deena. So when it comes to the use of continuous glucose monitors in the COVID-19 vaccine, it's important that if you're using your continuous glucose monitor on your upper arm, that you actually use the side where you're not going to be getting the COVID-19 vaccine, or use any other part of your body like your abdomen to insert your continuous glucose monitor. The reason why is because many of the vaccine formulations actually consist of sugar. Specifically, Pfizer, for example, has sucrose as one of its ingredients. And if you put the continuous glucose monitor right near your injection site, it might actually be picking up some of the sucrose and show you an artificially elevated sugar value that's not necessarily true. So it's important that at least for a few days after you get your vaccination, you put your continuous glucose monitor on the other side or find another area of your body that works for you. Hey everyone, it's Dr. Deena. So when it comes to continuous glucose monitors and the COVID-19 vaccine, it's important information to keep in mind if you have a Dexcom G4 or G5, especially, and even a G6, is that if you have side effects of COVID-19, often your doctor might recommend Tylenol, but you should know that Tylenol can actually cause false elevations of sugar levels if you have a G4 or G5. So you should definitely think about using alternatives to Tylenol to treat your fevers or muscle aches, etc. If you have a G6, taking Tylenol 1 gram every 6 hours shouldn't necessarily cause any false elevation of your blood sugar, but if you take more than that, it can. So if you're wondering, it's important just to correlate your finger sticks to what you're seeing with your Dexcom in order to make sure that you're in a safe place.